At Cook Children's, we've made a promise to improve the lives of every child in our region. Our promise means bringing innovative breakthroughs and family-centered care to all of our patients. We often start with the littlest babies in our newborn intensive care unit. These babies need specialized care in a warm and inviting place where the whole family can heal together. It gives them a new beginning, the chance to begin their experience as a family sooner.
It's the unit of miracles. I don't know any other way to say it. We have interventions and specialists and procedures that we can do to make the impossible possible sometimes.
My favorite part about working in the Cook Children's NICU is really helping to take care of not just the babies, but also the families that come to us. Whenever a child or an infant's admitted to the hospital, the whole family's admitted to the hospital.
When I take care of a patient, I take care of them as if they were my son or daughter.
I love children. I love newborns, but I also love critical care medicine.
Aside from a baby still being in the womb with the mom, and aside from being at home healthy and strong and thriving, that it's probably the next best place for them.
Our Teddy Bear Air Transport is the only transport team in the country that is totally dedicated to pediatric care. We have a pediatric team and we have a neonatal team. The transport team calls in during the transport, talks to the physician, tells us everything about your baby so that when your baby arrives in our NICU, we already know what your baby needs. A lot of the medications, a lot of that stuff has already been ordered. Your bed's ready, your room's ready, we're ready to take care of your baby.
In our unit, the parents can perform something called Kangaroo care. And Kangaroo care is basically skin-to-skin contact between the parent, the mother or father, and their baby. We have little harnesses called the Joey jersey, and it's a little device that we use to help support the hoses and wires and things that sometimes accompany the patients when they're at skin-to-skin contact with the parents. There's been numerous documented and researched benefits out of that skin-to-skin contact.
We have milk warmers in our neonatal ICU, and they warm the milk, and as they warm the milk, they vibrate so that they help mix it. It's very important that when you have breast milk that you don't shake it vigorously, because it does break down the live cells and the protection and immunities it gives to the baby.
I think we're one of 3 in the country that has its own breast milk bank within the unit.
In the milk bank, we do give moms labels. They will bring it in and into the milk bank with that specific label on it. It'll be processed with the same barcode. It'll go all the way through the system to the baby with that same barcode number. And so it's really safe. We can ensure that the baby gets the right mom's milk.
The most important thing that a parent needs to know when their baby is first admitted to our NICU is that we are able to offer services to their family, and we're going to take care of them. And the most important thing that they need to know is there are social workers, chaplains, child life specialists, just a variety of staff members there to help them. I don't know of many other places that consider a mother or a father actually part of the team. We don't consider parents visitors. This is your baby that we are taking care of. And so you're not visitors in our hospital. You're actually, you're a part of our team.
Our staff toured many NICUs around the country. We've read every article on single room design to make sure that all those best practices and other people's experiences were incorporated into not only the design of the unit, but the workflow of the unit and the way the care is provided. The administration at Cook Children's has been very forward-thinking in saying these are things we need to do for our NICU to make it the best in the country. And we think we do have one of the best NICUs in the country.
Everyone involved in the care of our patients, they have a certain affinity for babies and children in general. They have a certain calling to be in that population. And I really feel like it makes a difference.
Cook Children's is an amazing place to be. It is the only place I ever wanted to be as a nurse, and I'm very privileged to be an employee here.
I would encourage any parent who knows their child is going to need
a NICU to support them, or a parent who's in an emergency situation like I was, to really consider Cook Children's. The physicians are fantastic. The nurses are superior beyond imagination. They are my heroes. Everything about Cook Children's made me feel like something good was going to happen, and it did.
The Cook Children's Neonatal Intensive Care Unit, a place of endless possibilities for new beginnings.